Hello everyone, my name is Rawal Singh and I will be talking about computer vision syndrome today. So let's start the topic now. We'll discuss about the computer vision syndrome. So we'll understand the basic definition of computer vision syndrome, what is computer vision syndrome actually is and how it is causes. So basically, it is also referred as digital eye strain. There are group of eye and vision related problems that results from prolonged use of computers, tablet, e-reader, and cell phone use. So many individuals experience eye discomfort and vision problems when viewing digital screens. Level of discomfort appears to increase with the amount of digital screen use. Average individual spends 7 hours in a day on digital devices nowadays. So study have shown that every individual in India or wherever in the world spends almost 7 hours in a day on digital devices. It could be uh, laptop or anything. So we'll just discuss the causes for the computer vision syndrome. What are the basic causes to have the computer vision syndrome is viewing a digital screen often, uncorrected refractive error will increase the severity, presence of glare and reflections on the screen may make viewing difficult, eye focusing and eye movement requirements for digital screen can place additional demands on visual system. So we'll discuss the first factor about the blue light nowadays, which is very common in the market. Everybody in the optical or everybody in the individuals also discussing about the blue light. So we'll understand the basic concept of blue light, how blue light is helpful for your eyes or whether it is harmful for your eyes, and why blue light protection is required. So how it is related with the digital devices, we'll just discuss about it. So basically blue light is a visible light spectrum. So it comes into the visible light spectrum and it has a wavelength of 435 nanometer to 500 nanometer. So it is also shown that wherever the wavelength is lower, your energy of that particular spectrum or particular light would be higher. So if your wavelength is higher, say for the red color wavelength is 625 to 740 nanometer, so it has less energy, and for the violet it has the wavelength of 380 nanometer to 435 nanometer, means it has high energy level. So for blue light the wavelength is 435 to 500 nanometer, which is again comes with the higher energy light spectrum. So here we can see that this is the blue light spectrum, how it is looks. So 400 to 500 nanometer you can say is invisible spectrum, there are blue lights. So blue light is basically made up of sunlight. Sunlight is made up of red, orange, yellow, green, blue, indigo, and violet lights. So there are many colors in a sunlight, which are basically red, orange, yellow, green, blue, indigo, and blue, violet. So when all these lights combined, it becomes a white light, which we generally see. Each of these has a different energy and wavelength. Light that looks white can have a large blue component which can expose the eye to a higher amount of wavelength from the blue end of spectrum. So light which basically looks white can have a large blue component also. So larger source to blue light is sunlight and addition to it. So basic and major source uh, from which blue light comes is sunlight, and the minimum is fluorescent light, CFL component fluorescent light bulbs, LED light, flat screen LED televisions, computer monitors, smartphones and tablet screens. These are the additional sources from where blue light can also arise. So we'll just quickly discuss about the benefits of the blue light, how it is not only harmful to your eyes, but it is also it also benefits to your eyes also. It boosts alertness, helps memory and cognitive functions, and elevates mood. It regulates circadian rhythm, the body's natural wake and sleep cycle. Exposure to blue light during daytime hours helps maintain a healthful circadian rhythm. Not enough exposure to sunlight in children could affect the growth and development of the eyes and vision. Early studies show a deficiency in blue light exposure could contribute to the recent increase in myopia also. So your blue light is just not harmful for your eyes, but it has good benefit also. So we were just discussing about the benefits of blue light, that it boosts the alertness, helps memory and cognitive functions, and elevates mood also. So blue light is also required to our eyes. It regulates circadian rhythm also. Or if you are not exposed to enough sunlight or enough blue light in the childhood, could affect the growth and development of the eyes also. So how blue light affect the eye, how it is harmful to your eyes. So too much exposure to blue light late at night through smartphones, tablet and computers can disturb the wake and sleep cycle, leading to problems sleeping and daytime tiredness. The light may affect vision and could prematurely age the eyes. Say patient can get age related macular degeneration also if they are too much exposed to the blue light. So see how blue light affect the eye. Digital eye strains basically causes due to the decreased contrast when blue light is exposed to your eye, or when blue light is coming from your digital devices, causes it generally leads to the decreased contrast, and retinal damage can also happen, which is age related macular degeneration. So how to overcome from the blue light? So first is to try to decrease the time spent on your screen. Try to reduce the time which you are going to spend generally. Use screen filters for the digital devices. Nowadays many filters are available to just reduce the exposure of blue lights. Use yellow tinted lenses. Yellow tinted lenses will basically help you to increase the contrast for your system. Anti-reflection coated lenses to reduce the glares which generally arise from your digital devices. And there are blue light protective intraocular lenses can also be used while performing cataract surgery, so to have protection throughout the life. So this is how the blue light lenses which comes into spectacle lenses works. Generally it protects from the harmful blue violet rays, which has the nanometer from 435 to 500 nanometer, and rest of the lights are getting passed through the lenses, which you can see here. So we'll come to the topic right now, which we were discussing in the starting of our topic, that computer vision syndrome. We'll just discuss about the symptoms of computer vision syndrome. What are the symptoms which your patients going to face? Is eye strain, headache, blurred vision, dry eyes, neck and shoulder pains. So, symptoms of computer vision systems are caused basically by poor lighting. Say, if you are working in a room and your lighting conditions are not proper, you have made dim light conditions and you are using your smartphones, and then you are also using your laptops or anything, you are viewing a television in a dark room. So the poor lighting conditions can also cause computer vision syndrome issues. Glare on a digital screens. So many more glares are available nowadays. Many background reflections are coming, many background lightings are coming. So these just lightings are making a glare, and which leads to discomfort to your eyes. Improper viewing distances. Say if you have improper viewing distances, suppose if you are looking at a your desktop or any laptop or mobile, and you have not made a proper distance, you're not in a proper viewing distance, that can lead to computer vision syndrome. Poor sitting postures. So your eye level and your the level of your desktop should be as per the advice given by your optometrist, which generally has to be below your eye level, which is 15 to 20 degrees. So you can sit slightly above or slightly lower. So these are the not good sitting postures. Uncorrected vision problems. If you have some kind of refractive error and you're not using spectacles to correct your refractive errors, and directly using your devices, can obviously lead to vision problems, and that comes into the computer vision syndromes. So combination of all these factors is also a computer vision syndrome symptoms, which is poor lighting, glares on the screen, improper viewing distance, poor sitting postures, and uncorrected vision issues. So how to diagnose the computer vision syndrome? So we'll discuss the stepwise what are the steps to be followed to just diagnose the computer vision syndrome. Is comprehensive eye examinations has to be taken into it. Patient history is very important. Visual acuity test, refraction, testing how eyes focus, move, and work together. And now we'll move to the treatment part. Treatment part is computer vision lenses with correction. Computer vision lenses nowadays available with the yellow tint lenses, which basically helps to protect the lights from the blue violet rays, and with this lenses also will increase the contrast of your system, also will helps to maintain the contrast of your personal computer, so that it helps to maintain the computer vision syndrome. So location of the computer screen should be 15 to 20 degree below your eye level. Reference materials should be located above the keyboard and below the monitor, so you do not require to move your neck and just look at the reference material again and again, which can also lead to computer vision syndromes. Lighting, position of the computer screen to avoid the glare. So position of the computer screen has to be in a proper place to avoid the glares, to just look at the background lights which are coming, and just maintain all these positions so that you receive minimum glares from the backgrounds. And lighting position should also be in a good condition. Anti-glare screen can also be used to just treat the computer vision syndrome. Sitting position, as we already discussed, has to be in a proper way. You should take a good chair, you should have a good backrest, and your position of your eye level has to be 15 to 20 degree below, 20 degree above to your systems. Rest breaks, you should also take breaks. Meanwhile, 20 formula can also be used to take the breaks. You take a break after 20 minutes and just look at the 20 feet away for 20 seconds. Blinking should also help to treat your computer vision syndromes. And use lenses with yellow tint which blocks blue light and give good contrast. So basically the blue light protective lenses are available in a market nowadays, which generally helps to maintain the contrast, and these lenses also give a protection from the blue violet rays, which generally arrives from the digital devices, and it has a lower the wavelength but had a good energy level also. So thank you for watching the computer vision syndromes today. Thanks.